Guys, my name is Carrie Lee Brown, and I told my friend Mel of Mummy Bear's Health that I would take over her Instagram account because I'm a mom of two, and my pelvic floor is either too weak or too tight. But this is where Mel's gonna come in, and she's going to help me because sometimes I pee a little bit when I sneeze or I cough or I think something's a little bit too funny. I was super nervous about making this appointment because A, I know Melissa, she's my friend, could be a little bit awkward, and B, I wasn't sure I wanted to make time for my pelvic floor. That being said, family history, I have someone in my family that has to get surgery for a prolapsed uterus, so I don't want to have to deal with that when I'm older, and I'd like to be preventative. So, if you have any questions as a mom that's maybe been considering or on the fence about getting help with a pelvic floor physio specialist, feel free to ask questions. Okay, so I had to do a client intake form online before this appointment, or you can fill it out at reception when you get here. P.S. Don't mind my face, it's really red. I had a treatment, put makeup on over top. So what Mel is going to do now is she's going to go over my intake form, and I'll just let her explain it briefly so you can know what to, and then I'll ask her what I can expect during the visit because I have no idea. Okay, Mel, so what exactly can I expect in this appointment, and what are an example of maybe some of the questions that are on that form?
Okay. So first session will always be in an hour because I don't want to hear anything. I want to make sure that you feel comfortable telling me everything you want to tell me because these are things that you're not used to telling people about. I've asked about 3 pages worth of questions about things like peeing habits, pooing habits, what intercourse activities that you do, all that kind of stuff. And from Carrie's intake, I know that her bum feels tight all of the time, like her glute muscles feel really tight. Intercourse is painful since she had kids, and leaking when she coughs and sneezes. So I'm sure she's glad that everyone knows that information about her now. But from there, I have an idea in my head of what is going to actually assess her, and my guess is that her pelvic floor muscles are quite tense.
Okay, Mel, what can I expect during this visit? What are we going to do?
Okay, I was just telling Carrie that if my guess is right and your pelvic floor muscles are tight, then your pelvic floor muscles aren't necessarily tight because you wake up and tell them. They're usually tight because of things that you do in your day or habits that you've formed that make them tight. So I want to take a look at her posture, how she carries herself, what all the muscles are doing around her pelvis, how she moves, just to kind of get an idea on there. And then after that, I'm going to go inside her pelvis into her pelvic floor and feel all of those muscles, which maybe we'll talk about a little bit later. Yeah.
Awesome.
Okay, I was just explaining to Carrie, she's a bit of a bum tucker, so she tends to flatten her bum, which I call mum bum. But I was trying to explain here why that can affect your pelvic floor. So the pelvic floor is a big bowl that sits at the bottom of this. And the muscles are supposed to behave a bit like a trampoline. They're supposed to be very shock absorbing. They're supposed to bounce when we ask them, when we move, or cough or sneeze or go to the bathroom to them. And if you can imagine, I always tell people to think of the muscles like the bouncy part of the trampoline. The pelvis is like the frame of the trampoline that sits on the ground. And then all the muscles like the glutes outside of the pelvis are like the screws that hold everything together. And if you're having a problem, I guarantee there's an issue with all of those. If she's standing with a bum tuck, she's tilting her whole trampoline all the time, and I'm pretty sure it's the muscles in there because it's not sitting on level ground. So I just was explaining that to her because that's something that we're going to need to work on is her posture if she's ever going to let go of her pelvic floor tension.
Okay, Mel, what are you doing right now?
Okay, I am feeling through Carrie's abdomen because a lot of postpartum women have a lot of tension in their fascia in the abdomen, which can affect diastasis, maybe not healing as well, movement of all their organs. So I'm actually just feeling how well does her uterus move? Does it feel like it's on one side or the other? Does it feel like her bladder's moving well? And I'm actually noticing, like, for her, I want to gravitate over to her left. When I pull them to the right, they feel tight, and she actually even feels it pulling up in her kidney on the left there. She's had some back pain in the past, and that can definitely be contributing.
What are you going to explain right now?
I'm going to do an internal exam now, and I always explain that, you know, they're lying on their back on the bed. I have a sheet under them, a sheet over them. I don't use a speculum. I wear a glove and use a lubricant and go in with my finger to the vaginal opening and feel the pelvic floor from there. I'm looking for how much tension's in the pelvic floors, seem to have that kind of like trigger points in there, or more tension, and then how you do a kegel and how you relax your pelvic floor.
So this is the part that I'm probably sure a lot of you are nervous for, because I mean, let's face it, who likes an internal exam? No one. So let's do this. Okay. So quick synopsis.
Okay, so I already talked about a little bit what I felt on the outside. When I did an internal exam, Carrie definitely had a lot of tension in her pelvic floor, especially at the back. So, and it was reproducing the feels, which tells you that it's definitely muscular related. So we worked a little bit on kind of releasing some of the tension in that area, but then most importantly, sent her home working on how to do a proper tightening of the pelvic floor, proper relaxing, so that she can actually get some movement in her pelvic floor. And then we talked a little bit about why her muscles are so tight. So she's going to work on her posture a little bit, because I think that's why she has so much tension in those muscles. And I'm sending her home with some homework to stretch out her tight butt muscles and, yeah, get her pelvic floor moving.
The tennis ball. Thank you for helping me with my pelvic floor. I got little stickers to put around the house to help me with my posture and to remind me to do my proper kegels, because she taught me the proper way of doing them. I noticed a huge difference on the release of it. It almost felt like I was just constantly holding it before. So that was amazing, and she taught me exercises to do, and I'm just gonna flip it around in a minute and give like a conclusion.
Number one thing that I actually just want you to get out of this is that everyone is so different. So you definitely got kind of the Coles Notes version of what I look for, or what any of us look for, but you have to keep in mind that depending on what you're coming in for, assess different things, and we're going to definitely treat it a different way. But that just gives you an idea of the basics of what we're looking at and what we'll send you home with.
And you've got the thing, the pelvis in your hand, in my lap, and she was like physically showing me what muscles were tight and which ones she was working on and how they all connect. And it was just really good to get like a visual while doing the exercises.